I'm Julie Barkey with this Senate update. Senator Kathy Sheran is carrying legislation that she hopes will help improve the conversations that need to happen as a person reaches the end of their life. She unveiled her proposal in a news conference on Wednesday.
Good morning. Thank you for your interest today and for staying to hear about Senate File 410 and Senate File 407. Both of these bills are designed to encourage the use of effective methods in communities to engage families in important early conversations about later stages of life. As you know, the governor's budget supports another proposal that focuses for planning of life's transitions in later life. It's called Owning Your Future. But this proposal focuses on encouraging early financial planning. Earlier conversations are important, especially about subjects that we would like to avoid or put off. And as a consequence, if we avoid or never quite get to those conversations, we create a crisis conversation that can occur when we haven't really clearly defined the roadmap we want to the unstated goal of living life in all of its phases as we would choose, with as much control over the experience of living that we can achieve. Life's transitions might be thought of like sporting events, with quarters and half times. Conversations about the first quarter, which is birth, infancy, youth, adolescence, or the second quarter that's about emancipation, maybe military service, work, skill development, marriage. These are transitional phases in life. And these transitional phases are constant in our families' conversations. They're constant in our spiritual communities and in our churches, in our nonprofits, or in government itself. We talk about how to do these phases, these first quarters of life, so that the developmental processes create a positive outcome for those individuals who move through those life transitions. However, early conversations about the latter life transitions often are left at the wayside. And as a result, these conversations become emergency decision-making, and rather than careful or thoughtful conversations with family or with spiritual advisors or our attorneys, as well as our healthcare providers, these conversations need to be as early and as constant as our conversation about growth and development during the early stages of life. The bill that we are talking about, the two bills that we're talking about today, join the governor's proposal, Own Your Own Future, by providing grants to communities to develop or plan to engage their communities in these kinds of conversations, not only about finances, but about various needs like living preferences, caregiver preferences, estate management perhaps, who will have legal authority, what are our spiritual desires at the end of life, desires that we take about our care when life has taken away our ability to communicate those preferences to our family or for our physicians. The grants will be designed to utilize the SHIP model. The Commissioner of Health is charged with awarding these grants that encourage the conversations in a targeted initiative that encourages making life planning resources available to families. The grantees have to report to the Commissioner on their progress. This same bill, which is 410, also directs the Commissioner to award another grant to an organization that is a statewide advanced care planning organization for technical assistance to the grantees and to give them accesses to the resources that have been developed that demonstrate best practices in this arena. The second bill is Senate File 407, and it provides funds for Honoring Choices, which is this Minnesota nonprofit that encourages families and communities to have these discussions about the end of life care. The organization uses outreach and educational materials to urge Minnesotans to have these discussions before they become necessary as a result of an illness or life event. The funding would allow this organization to continue their work. So at this time, I would like to invite Dr. Greg Kuchar, who is a family physician at the Mayo Clinic Health System Southwest, to speak about the grant, the bill that relates to the grants to communities. And then that will be followed by another statement on the other grant. Dr. Kuchar.
Thank you so much, Senator Sheran, for leading with this effort. I'm going to try to make this a very simple story because it gets lost in some of the complexity, and the story goes like this. Healthcare itself has become far more complex over the last 10 to 20 years, and the decisions that families and patients face are baffling to them, and particularly in times of stress. And if we want to help them make decisions that are truly around their wishes, they need to have time to have the conversations about what their wishes are and further define those. When those conversations do take place, it's inspiring. But all too often, those conversations don't take place, and the decisions are not made with good information, and there's suffering for patients and their families that doesn't need to happen. We know as healthcare providers, as a healthcare industry, that we are working on helping people have these conversations, but the truth is we can't do it by ourselves, and because so many of these conversations should take place in the community, in other settings, in non-traditional healthcare settings. So what these bills will do is take techniques that are already in use, but enable them with a small investment to expand the work that's being done in communities, engaging people where they live, where they work, in their faith-based communities and others. This bill will help with resources so that we can get the conversations out. And the result will be patients making better decisions, less suffering, and it's one person at a time that will receive the benefits from this. I'm very passionate about this, and I really appreciate your attention to that and the leadership of everyone who's on this bill. So thank you.
This second speaker will speak to the other bill, Senate File 407, which is the dollars that are going to an organization that provides this technical support. And to speak to that bill is Dr. Ken Keppert, and this is quite an impressive statement of who this person is and the many ways he serves our communities. He's the Medical Director of Geriatric Services at Fairview Health Services. He's the President of the Twin Cities Medical Society and the Medical Director of Honoring Choices, which is going to be a recipient for one of these initiatives. So in addition to that, he happens to be a practicing family physician. So with that, I'd like to introduce Dr. Ken Keppert.
Thank you, Senator Sheran, for taking the lead on this. We've been working with trying to have conversations. We started in the clinics, and we quickly realized, as Greg mentioned, that we really need to move outside the clinics and have programs that engage community members who maybe aren't actively engaged in the clinic. So we've been created over the last several years ambassador programs to try to get to different cultures, different communities that aren't very actively engaged in the healthcare system, and these tend to be communities that have some of the largest healthcare disparities. So there's a lot of work that needs to be done outside of clinics to reach people to start to have early conversations. One of the other learnings we've had over the 6 years is that this is not a one and done conversation. This is, you start the conversation hopefully when people are relatively healthy, and the main goal is to just ask them who they want to speak for them if they're too ill to speak. Who should we come to? And ask questions about treatment. And that seems like a simple question, and usually it's a spouse or if they're not married, a significant other person or their parent even sometimes. But it gets more complex as people get older. I would just tell a little story. I have these discussions weekly, and so a man was telling me what his wishes were as he was approaching the end of life. He had end-stage heart failure, and and knew his time was getting limited, and he described how he preferred his death to be in the home and under what circumstance. And as he was talking, I could see his wife go pale because she was she was his next of kin and be the one to, if he was too sick, would have to carry out these instructions. And so I asked her, would you be able to do this? And she said, no. I know that's what he wants, but I just can't do that. I've married to him for, 50 years. Can't do it. So we had it pulled in the kids, and we had some more discussion. And eventually one of the kids stepped up and said, yeah, I can do this. The wife was fine with this plan, but somebody else needed to be making those decisions. So that's just an example of how something that sounds simple can be complex, and you need trained people that can help guide people through these and ask the right questions as they're giving you their wishes. And I think we have the tools now after 6 years of working on this to help any community that wants to engage in improving advanced discussions for their patients and families. So I don't think I'm going to take it longer.
We'll open this up to questions, but I do want to make certain that you know who the co-authors are on this bill, who are with me here today, and I would invite them. I'll give you a few seconds to think if you'd like to make a statement. So with us is Senator Senjum, also Senator Franzen and Senator Rosen, who, along with Senator Marty, are co-authors on this bill. And I would just offer the opportunity to anybody who would like to make a statement about the bills at this time or answer the questions as they come forward. Do you have a preference? Would you like to make a statement? You can, if you'd like to.
I have nothing to say other than there's no axiom that, a couple of the things that are most certain in life are death and taxes. And we do talk about taxes a lot at this institution as well as across the state of Minnesota, but we don't talk a lot about death. And I think that's what Senator Sheran's bill, which I'm proud to be a co-author on, is about to do. There are realities in life that we need to face up to as individuals and as families, and I think this will help encourage that conversation along. It's very, very important. None of us personally wants to go through this, but again, it is a reality. We need to face up to it. I congratulate Senator Sheran on this initiative, and it will, in fact, I think, open some conversations that maybe otherwise wouldn't be opened. So thank you very much.
Thank you all for being here, and you would think or ask yourself why a young senator from Edina is concerned or interested in this bill. I've been having these conversations during the interim with stakeholders, and it certainly is an area that I'm very interested in working with on from the HHS perspective. My district, in particular my city of Edina where I reside, has a significant senior population and a lot of doctors in my district. So certainly this issue has been come to light in the conversations, meeting with all these constituents. And, to share a personal story, too, of why I'm personally engaged in this issue. 3 years ago, almost 3 years ago, I received a call from my father, who never calls. We have a great relationship. He just doesn't use the phone. And he called, and when he calls, I usually am alarmed. And there was reason to be alarmed because he can barely speak. My grandmother had just a stroke, and I'm originally from Puerto Rico, so it's a far place to go visit. But I was there almost the next day, and I just spoke to the doctor in the emergency room, and they said, she's not going to get any more or any much better than what you see today. And 3 years later, it's the truth. And knowing my grandmother, who I love dearly, had she had these conversations early, I probably would have known what her conversations would have been like and her choices would have been like. It was a state of panic and scare, and the family got involved, and of course they did what they thought was best. But I think we all should have that opportunity to have these conversations. And it's not just about money. That's what we end up talking about. It's not about saving costs. It's about saving people's quality of life. And I think we should all know what's at stake with the decisions that we make and have a medical directive and start early. I joke that I'm 34 years old, but I should start saving for my hip replacement. And now I'm serious. I know I have to because the resources are just not there, and the state can do its part, but we need everybody to take part in ownership on these decisions that are really hard but are part of life. So that's my interest in co-authoring the bill with Senator Sheran, and I really look forward to having it pass. Thank you.
Thank you very much. So you can see that we all share an interest, first of all, in understanding that life has developmental stages, has transitions, that we spend a lot of time and aren't afraid to talk about some of the early stage transitions, but we tend to avoid the later life transition discussions. And what this bill does is to try to provide the technical resources to communities so that they can begin to have those conversations, and then some grants to help those communities initiate that. I should say that we are using the SHIP model, which I think you're familiar with. It's the State Health Improvement Program process, which allows communities to define how they want to engage their communities in this process and to determine what their priority is for focusing those resources. We heard about travel, long distances that have occurred with Senator Franzen. One idea that a community could do is develop a interactive virtual communication system so that early, not when a crisis occurs, but early, community members can come together and meet virtually with one another to have this conversation instead of waiting till the Christmas gathering or the Thanksgiving gathering, and have it be facilitated by someone who's trained through honoring choices to help facilitate the conversation, knowing how to do that well. So that's just some ideas about how that might be applied in a community, should they think that that's a good idea for that community. But it could be a variety of options that fit within the parameters that are defined in the bill. And so with that, I think I will step back and let you ask our presenters questions, if anybody has any.
Senator, is the bottom line here too many resources are going into end-of-life care because these clear directives aren't available in most cases?
Well, you should know where I'm coming from, that the bottom line really is about quality of our life. That we want to, just like we do in the front end, make sure our children's quality of life is wonderful. And we do pay attention to trying to do that efficiently and effectively. But the lead is that we want our children to go through the developmental processes at the very highest level. And that's what the bottom line is on this, that this process allows people to design, have conversation about how in the second half of life, that they can design their life in a way that increases their sense of living their life well as long as they are alive.
Could I take a stab at
Yes. Dr. Kuchar.
It's a great question, and I think all of us in healthcare see this more of a quality of life issue. And there are now studies coming out to verify that. So the poster child is a very large scale study on lung cancer. So patients diagnosed with stage 4 lung cancer, which is a very serious disease with not a very long-term prognosis. But when patients with stage 4 lung cancer start in what we call palliative care, which is really a model based on having these conversations. The study showed 3 things: that through the process, patients and their families are happier with how it goes. Their journey is better. Second thing is that it does cost less in terms of resources, but the real shocker is that patients live longer. When they're making decisions that are around what their needs are and what their desires and wishes are, they do better. And so this is about having the right conversations. The resources sometimes are secondary benefit, but that's not the driver.
Yeah, I would just second that. I think the experience of many people, and it's been confirmed with many different studies, is without any information that the family can give on a very sick patient, even if the patient survives, patients and families feel like when they enter a hospital and they're very sick, what happens, they call it like a runaway train. Things start happening to them in a crisis situation with very little discussion about the risks and benefits of the procedure, the likelihood of it working. And at the end result, the families, and if the patient survives, are very, very dissatisfied with the painful care they received. And it isn't what they would have wanted if they would have had some discussions about it.
So it's fair to say that these are probably difficult conversations for many families to have. Do you think that this idea of doing it early will be embraced?
Yes, because actually the biggest, an obstacle that a lot of the families have, a lot of the patients I deal with who are a little older, but still pretty healthy, come into clinic, is that when they've tried to have these conversations with their children, the adult children don't have anything to do with it. So having a trained facilitator in to help engage the family is successful. They are difficult conversations. And sometimes you need to ask, and the kids need to be asked several times before they're willing to engage. And that's why it's not an easy thing to accomplish. But generally the response, especially when we did several programs with Twin City Public Television that got a very good response about having advanced care plan conversations. And it's been very, in fact, I would say the community's changing their culture quicker than the medical community inside is changing its culture. So I keep working on the inside to make sure that people ask about, what if somebody has an advanced plan that they want to talk about, asking who is supposed to be the decision maker instead of assuming it's the person that shows up in the emergency room. And then trying to make sure we honor that discussion instead of having somebody say, well, you didn't really understand, I'm still going to go ahead and do this because I think that's better, kind of the paternalistic approach.
Well, thank you. And as you can see, this issue is bipartisan. It is spread very well throughout the state. And as a senator who serves a district that has a very high proportion of seniors, this is an issue that we as legislators probably tend to skirt a little bit. It's never easy to talk about end-of-life issues, but it's an important piece of the entire long-term care issue that is at the Capitol, that's getting a lot of attention, whether it's our home community-based or our nursing homes. And we need to continue the conversation with this palliative end-of-life issue. And I look forward to it. I want to thank Senator Sheran for bringing this forward, Dr. Kuchar, who's close to my district, for coming forward too, and Doctor for also being here. This is a very, very, very important issue that makes us uncomfortable, but we have to have the conversation.
How much money are you seeking?
I have not established the number yet. I'm in conversations. It is based on the SHIP model. It's going to be continual funding, so I'm trying to establish what might be a reasonable amount of money to use for this first round of funding, and I will have that decided by the time we get into finance. And I want to acknowledge that Senator Marty, who's also a co-author, is here as well. And then to the discussion, it's interesting that the first question that comes up is the bottom line on this about finances? And I appreciate that question, but I want you to know that I'd like you to listen to how we're trying to talk about this, because it's about earlier conversations like we do other earlier conversations, and that those conversations relate to what everybody knows are life's transitions, and that it's about having choices and conversations about how to live life well. Even though we all know that it is finite, life is finite. So I think how we talk about this is important in terms of how we work with that anxiety people have about having this conversation. So if we can begin to talk about the value of having this conversation, because it means the people we love will live their lives well, that people would lean forward more and engage in that. If we talk about it in a different way, it creates a different reaction, and so you will play an important role as you begin to talk about this and how well received these ideas are in the community. So, thank you. Thank you.